Mastering Nursing School. Overcoming 5 major barriers to success and excelling as a nursing student. What you need to know. Today, we will discuss the 5 major barriers to nursing school success. Let's begin. The goal of a nursing program is to graduate competent, compassionate, and responsible beginning-level nurses who can effectively address the healthcare needs of our community. Nursing is a complex and multifaceted profession, and the educational path to becoming a nurse reflects this complexity. Nursing schools aim for incoming students to be as well prepared as possible to ensure success. However, there are several common barriers that nursing students may face. Many students report feeling overwhelmed when confronted with the program's demands. Exploring these barriers and expectations will help you prepare for and navigate potential obstacles, ultimately enabling you to meet the program's requirements more effectively. To succeed in a rigorous nursing curriculum, students must have a solid academic foundation. This encompasses advanced skills in reading comprehension, grammar, vocabulary, and mathematics, as nursing textbooks are typically written at a college level, grade 13, and above. Proficient reading skills are essential for comprehending intricate content, and effective communication with an interdisciplinary healthcare team necessitates a strong command of spoken and written English, including grammar and vocabulary usage. Nurses administer complex medications in pill and liquid forms and through intravenous injections. Consequently, exceptional mathematical skills are imperative to ensure the precise delivery of pharmacological treatments. Traditionally, many courses completed before entering nursing require students to memorize and regurgitate information for assessments. However, nursing demands more than merely knowledge and comprehension. It necessitates critical thinking, strategic planning, and decisive action. When confronted with a patient in distress, nurses are not expected to merely recite information, such as the top 10 reasons for bleeding. Instead, they must engage in effective interventions to address the situation. Nursing decisions are rarely clear-cut, contingent upon carefully collecting and analyzing patient information. Alterations in clinical data may necessitate shifts in decision-making. Nursing education's learning experiences and assessments are geared towards application, analysis, and higher-order cognitive processes.
To cultivate these higher levels of learning essential for critical thinking, students are encouraged to engage in extensive research regarding practical study and test-taking strategies tailored for advanced cognition. It is paramount that their study methods are both efficient and effective. Merely increasing study hours is not a guaranteed pathway to success. Even those students who have excelled academically in high school or prior college courses may find that the learning demands of nursing education necessitate additional support in adopting an optimal approach to mastering the material.
Excessive work hours are a prevalent reason for failure in nursing programs. This can significantly limit the time available for studying, leaving little room for employment. It's essential to assess your financial obligations, develop a budget, and calculate school-related expenses, including the cost of the program, childcare, transportation, lost income, and other associated costs. This review will help ensure that you can finance your education without needing employment or with minimal hours if studying part-time. To manage your finances effectively, consider reducing your spending and saving money in preparation for the program. Additionally, exploring financial aid options can provide support to help meet your needs while you're enrolled. If you determine that full-time work is necessary, we recommend gaining employment for a few years to build a solid financial foundation before pursuing the program. A major challenge nursing students face is managing stress and developing effective coping strategies. Before starting the program, it is essential to cultivate strong stress control and reduction skills and productive coping techniques. Practicing these strategies beforehand is essential to ensure readiness when challenges arise. Nursing students greatly benefit from the unwavering support of their families and friends. This support can take many forms, including moral encouragement, well wishes, and practical assistance with childcare, cleaning, shopping, and various household tasks. Maintaining a balanced life that encompasses family time, exercise, proper nutrition, and adequate sleep is essential. However, prioritizing the nursing program is crucial. Effective time management is essential for achieving success and managing stress in nursing school and nursing practice. Take a moment to outline how you allocate your time over a 24-hour and 7-day week. Identify areas where you can save time, perhaps by stepping back from roles like class parent or scout leader for a couple of years, and find opportunities where others can assist you, such as cleaning, cooking, picking up children, or babysitting. Your schedule must accommodate the 30-plus weekly hours dedicated to classes, clinicals, skills labs, and studying. Some students find it helpful to seek support from family and friends. However, it's worth noting that some family members and friends may not support your journey as a nursing student. They might make discouraging remarks such as, "You'll never be able to be a nurse," or "Why are you wasting your time studying?" Additionally, their actions may undermine your efforts, like promising support, not following through, or creating distractions just before essential exams. Recognizing such individuals and their behavior is crucial. Develop strategies to mitigate their impact, including setting boundaries or distancing yourself from them when necessary. I encourage you to pause and reflect on your feelings about the following: academic skills at the college level, higher-level learning and critical thinking, effective study skills, test-taking skills, financial status, budgeting, financial aid, personal stress management, personal coping strategies, time management, home and work schedule versus schedule for class, clinical, skills lab, studying, family and friends support, and moral support. Identify any areas of weakness and develop a strategy to address them. Implement your plan and assess the outcomes. If you encounter a significant challenge, reflect on whether this is the right time to enroll in the nursing program, or consider devising a long-term plan to resolve the issues before applying. If you enjoyed this content, I'd love for you to hit the subscribe button. Give me a thumbs up and turn on notifications. I can't wait to see you again soon.